Hi there. In this video, let us look at hyperthyroidism, signs and symptoms of an overactive thyroid.
Hyperthyroidism occurs when your thyroid gland is overproducing thyroid hormones. This can cause symptoms that may include weight loss and increased appetite. The thyroid is a small, butterfly-shaped gland located at the front of your neck. It produces thyroxine, T4, and triiodothyronine, T3, which are two primary hormones that control how your cells use energy. Your thyroid gland regulates your metabolism through the release of these hormones. When your thyroid makes too much T3, T4, or both, it speeds up your body's systems, causing distress. Hallmark signs and symptoms of hyperthyroidism include weight loss, rapid or irregular heartbeat, feeling nervous or irritable, feeling fatigued, hand tremors, muscle weakness, getting easily overheated, goiter, and bulging eyes. A variety of conditions can cause hyperthyroidism. Graves' disease, an autoimmune disorder, is the most common cause of hyperthyroidism. In Graves' disease, your immune system attacks your thyroid gland with antibodies, resulting in the release of too much hormone. Iodine is a key ingredient in T4 and T3, and too much iodine can cause temporary hyperthyroidism. Iodine can be ingested through food like fish and dairy. It is also present in certain medications, such as amiodarone, used for heart arrhythmia, cough syrups, and medical contrast dyes. Thyroiditis refers to conditions which cause the thyroid gland to swell, making either too much or too little of the hormone. Nodules are lumps that develop on the thyroid gland, often for unknown reasons. Some thyroid nodules produce excess thyroid hormones, but the majority are benign. Nodules are also called benign tumors or adenoma. Some thyroid nodules are malignant or cancerous. Whether a nodule is benign or malignant is determined by ultrasound, or with a kind of tissue biopsy, called fine needle aspiration. High levels of T4 can result from taking certain dietary supplements, or too much of the thyroid hormone medication, levothyroxine. Untreated, hyperthyroidism can contribute to an increased risk of thyroid storm, pregnancy complications, osteoporosis, cancer, stroke and heart failure. Your body enters overdrive as a result of too many thyroid hormones in your system. A thyroid storm is a potentially life-threatening combination of symptoms, including rapid heart rate, high blood pressure, and fever. High thyroid hormone levels can harm both pregnant women and the fetus. Risks include miscarriage and premature birth. Regular thyroid hormone tests during pregnancy can detect irregularities. Hyperthyroidism can cause your bones to become weak and thin, which can lead to osteoporosis. Taking vitamin D3 supplements during and after treatment can help improve bone health. People with hyperthyroidism may develop thyroid cancer, called thyroid carcinoma. Thyroid cancer in hyperthyroid patients was more aggressive and had a worse prognosis than in euthyroid patients, those with a healthy thyroid. Hyperthyroidism can also cause atrial fibrillation, a dangerous arrhythmia, or irregular heartbeat that can lead to stroke, as well as congestive heart failure. There are a few ways to check for hyperthyroidism, such as blood test, thyroid scan, ultrasound of thyroid, and CT or MRI scans. Blood tests are a very reliable way to confirm a diagnosis of hyperthyroidism. Blood test used to measure how much thyroid hormone, T4, and T3, as well as TSH, is in your blood. Thyroid scan can be used to see if your thyroid is overactive by measuring how much iodine it takes up from your bloodstream. In particular, a thyroid scan can reveal whether the entire gland or just a single area is causing the problem. Ultrasound of thyroid measure the size of the entire thyroid gland, as well as any masses on or in it, such as nodules. Doctors can also use ultrasounds to determine if a mass is solid or cystic. A CT scan or MRI can show if a pituitary tumor is present. Antithyroid medications prevent the thyroid from making hormones. The most common antithyroid medications are a class called thionamides, which includes the drugs methimazole or MMI and propylthiouracil (PTU). Radioactive iodine, RAI, also just called radioiodine, effectively destroys the cells that produce thyroid hormones without damaging other bodily tissues. It is usually taken as an oral tablet or liquid. During a thyroidectomy, all or part of your thyroid gland is removed. Surgery may be used for patients when all other type of treatment aren't suitable. If your thyroid gland is fully removed, you will need to take thyroid hormone supplements for the rest of your life. The drug levothyroxine is a synthetic version of the thyroid's T4 hormone and is usually prescribed in pill form. The long-term outlook for hyperthyroidism depends on its cause. Most cases, including Graves' disease, will worsen without treatment and can become life-threatening. The good news is, hyperthyroidism is very treatable, and many people with it are able to get back to full health.
Thank you for watching. If you like our video, please share, like, and subscribe our channel. Click the bell icon and let's meet again in our next video. See you soon.